So we're inside Millsap Veterinary Clinic. We get a lot of referral surgeries here and there. We're not technically a referral center, but we do a lot of high acuity surgeries, orthopedics, advanced soft tissue surgeries. Like later today, we're going to do mandibulectomy. We have a lot of TPLOs that we do. We're doing a few this next week. So I was going to go through with our vet student, Sierra, on how to plan our TPLO. And I've mapped part of it out already. So basically on here, what we're measuring the tibial plateau axis. So if we view out, we put one point down here within the talus, and then another point through basically where the ACL attaches on this one specific crest on the tibia. And then we draw a line where our tibial plateau axis is, and I've already calculated all this. So we know we need to rotate this based on the tibial plateau axis, and we'll go ahead and rotate this real quick. And I calculated we need to rotate 6.8 to about 7 millimeters. So we're going to rotate this to 7 millimeters. Now we can see that tibial plateau axis has actually changed. So I'll change this so you can kind of see how much this changed in reference to it. We want to get this to around into like a 0 to 5 tibial plateau axis. And if we need to rotate just a little bit more, we can. This allows us to do a lot of pre-op planning prior to this. So then we're still at maybe a little bit of a negative slope, so maybe we'll rotate just a little closer to that 8. There we go. That looks significantly better. So we're going to gown up and get ready, and we're going to go into surgery. We have a couple spays this morning, and then this afternoon we have a mandibulectomy, we have a fractured jaw, and then we have another mass removal, so that way we can go ahead and fix all those things. Now, a few of the things that we have different here is that we have ligature, and we actually use it not just for like splenectomies and higher surgeries, we also use it for our spays. And the reason is it allows us to where we can ligate the ovarian pedicle, and to where we don't have to put any actual suture in, no implant, and so they actually heal faster. It's pretty cool technology. Mostly ERs and board certified surgeons have that type of situation, but it allows us to do more and help more patients. And it's something sometimes a lot of the vet students haven't ever experienced before. We're just trying to help more patients by doing some of these more advanced things, and then by being able to do it for a cost-effective clientele. So now that we got that, this is the one big advantage that we have here. The clamp. Hit the button. It'll tell us when it's ready. Sometimes I'll hit it a second time. The coolest thing about this thing, it can do up to 7 millimeter vessels. So, I mean, they use this for ovariectomies in humans. I've used this before on ovariectomies in horses, and I'll use it on my broad ligament here too. You know, it makes it a little bit better. So we just have less bleeding, less implants, and they just, like I said, they heal faster. Okay, so this is Sierra. She's a veterinary student that's here with us. She's also Dean's daughter, but she's learning a new way of how to spay. She's going to use the ligature today, so let's go ahead and show them. So across our broad ligament, go ahead and clamp. Hold the button. Good beep. Now pull the trigger. Pop, and then after that, pop it open. Boom. Okay, now let's keep going and put it to about right in front of that vessel. So right there. Okay, stop right there. Clamp. And pull the trigger. Pop it open. Beautiful. No bleeding. One of the best parts of it. Didn't put anything in there. Okay. Okay, pull the trigger. All right, and then get your last little bit. Go a little bit further up, yeah, right there. Just proximal, perfect. Hold it down. Pull the trigger. Beautiful. Now, it's not gonna be that easy in school. Yeah. In school, you're gonna have to tie it all off. The beautiful thing about using the ligature, and we just
you have like no bleeding, you're not leaving anything in there, so they're not gonna have a reaction. It's, I can't stress how amazing using that is and what a game changer it is. Also just using less suture, period. It's just really cost effective for everything, so we can keep the cost of our spays a little bit lower.
So do you use the ligature with all of your spays now, or do you ever still traditionally tie off?
I still tie off a couple of them on my really big spays if I'm worried about it. But I would say 90% of them I'm able to use the ligature, so it really isn't a big deal. It's great for like things like splenectomies. They'll take a splenectomy and turn it into like a 15-minute procedure potentially,
right.
you know, or at least getting the spleen out. But it's so quick and so nice. It's highly cost effective.
Did you ever feel nervous for your first couple of surgeries, or did you just go into it knowing that you were capable and saw what happened?
Well, the answer to that is both. So I used to rodeo quite a bit, and I backed in the box in front of a lot of people to where I wasn't nervous. And when I was really young, my mom, who's also a vet, she told me, you know, whenever you walk up to a surgery, you should feel and you should be the one who knows the most about that procedure. And I took that to heart.
Yeah.
So when I was walking up to any surgery, I had everything. I'd already gone through that surgery on that specific animal.
Yeah.
100 times in my head before it goes in. Now there's always complications that may be different, but make things a little bit different. But in reality, it was never really an issue for me. It was like that and nervous anticipation, but once I started, it was never really an issue.
Felt comfortable.
But I think that's the thing that everybody always thinks, like, you know, oh, like I'm in vet school, I'm here to learn, but like I spent extra time studying and mentally preparing for a lot of this stuff.
Oh yeah.
To where it would set me up for success with it. But I mean, yeah, I was definitely nervous. I mean, everybody is. You want to be good. Everybody wants to be a rock star. You know. But that's one of the things too that I tell everybody, every vet student that comes in here. The best thing about your veterinary medicine, you get out of it what you put into it. So if you put extra time in studying, it's gonna pay off. If you put extra time in mentally preparing for your procedure, man, you're gonna smoke it, you know?